just fine, right?
It does, yes.
Okay, so I'm recording to the cloud. And
did you want me to say the second slide?
Yes.
Just pop in. Okay, just making sure. Great.
Yep. And any other questions before we go live? I think we can probably we'll give it another couple minutes because I'm perpetually running late. And, I feel bad normally when I have a town hall meeting, everyone comes and you all get free bottles of water. And now I just, feel like an interloper in all your homes. So.
No, it's great. Yeah, thank you
Yeah.
for doing this. It's really important.
Yeah, well, it's this is I say in social distancing, it's simultaneously more distant, but somehow more personal in some ways too. So
Yeah, I think so.
All right, last lightning round question: does anyone have a favorite Zoom background that they've been using at all?
Haven't even played with it yet.
All right, I'm gonna do my Zoom background joke and hopefully not break everything at the same time. So you know how Jared Polis got his money was starting out with a flower delivery business that was an online business.
Yeah.
And so I was like, well, how will this work in the era of social distancing? And then I found a perfect background for it.
Wait, I have to show you something.
Uh-oh.
Perfect.
No, I don't have it hanging, but that's what.
Oh my God.
I should put it back in there.
Yeah, you got his business card. That's awesome. So that is one of my favorite pictures, actually. All right, we are recording. I'm gonna hit. We'll get started about a minute late, but what do I have to do? Hit broadcast.
Yep, that's it.
Now broadcasting to all attendees. Now I'm gonna start streaming this on Facebook as well. And of course, now it wants to stop working for me as soon as I said that. And we'll give it a minute as the participants come in. Welcome, everyone. We're going to wait just a couple more minutes while people get logged in, but thank you for joining us. And we'll give it about another minute. We'll get close to 6:30 p.m. as possible, but give people a minute. I know parking is really hard right now, so it's always been a challenge.
Looks like hi to Sylvia and Lynn, who joined and said hi in the chat.
Always good. Welcome. Okay, it is about 6:31 p.m. Mary, do you want to hit the present button on the slide? Just hang over. There you go. Is that gonna maximize there? If not, we may just leave the slide deck as it sits. Okay, well, I want to start off by just saying, first of all, welcome to everyone who's come to join us today to have a conversation on addiction and recovery in the era of COVID-19. I know this is definitely one of the more challenging issues that we've ever faced in the state of Colorado is dealing with our addiction crisis. And we have a team of experts here to talk to us about that today. But before I start, I want to have Jamie give a brief introduction in Spanish with some instructions on how you can log in both English and Spanish today.
Bienvenidos y gracias por su interés. Para escuchar la interpretación en vivo en español, haga clic en el botón de Interpretation y sintonice al canal. También, si usted tiene una pregunta, se puede poner en la función Q&A. Muchas gracias por venir y estar aquí con nosotros. Estamos agradecidos.
All right, well, thank you, Jamie. And we've got the thumbs up from interpreter Martine. Before we get started, I want to put a special thanks to my intern. So my aide, Mary, thank you very much for helping get the PowerPoint slides started here tonight. And then also to Hunter for getting our speakers here today. So we are joined by a great group of folks here tonight. And I just want to kick this off by saying if you are feeling like you are struggling right now, please don't be afraid to reach out to folks over the chat line here or the question and answer line here. And if you do have questions as the presentation is going, please don't hesitate to hit the question and answer link on the very bottom of your screen. And you can put those questions out there now as our speakers have a chance to talk tonight. We're hoping to have a conversation today, much more than a presentation or a lecture. We really want this to be interactive. And and I already see some questions out there, and so I'll keep a close eye on that. And this is being recorded, so if you can't stay for the whole thing, please feel free to log in later. We will repost this on YouTube and Facebook. So with that, why don't we go to the next slide, Mary? Okay. Or we'll just go to our first speaker as we're sort of sitting here frozen. First up, we have Dan Amon, and Dan is with the Longmont Public Safety Office. Dan has been there a lot longer than I've been probably pretty much anywhere and has done an amazing work serving our community. So Dan, when you're ready, please share with us a little bit about how things are going right now in Longmont and what you'd like to see happen maybe as we move forward here in this era of coronavirus.
I would be happy to. Good evening, everybody, and thank you very much for joining us on this virtual town hall, and thank you to Rep. Singer for organizing it. Yeah, my name's Dan Eamon. I'm the Assistant Public Safety Chief for the City of Longmont, and currently I'm overseeing the response to the COVID incident, but in my normal duties, I oversee all the diversion programs for the city. And we have 4 primary diversion programs. One is our core team, which is a pairing of a police officer, a behavioral health clinician, and a paramedic that respond primarily to behavioral health calls for service. And then we have a range of diversion programs that use the peer case manager concept to build individual connections with individuals that are needing assistance of some kind. One is a law enforcement assisted diversion, which takes diversions out of the criminal justice system. We have a community health program, which does the same out of the medical system. And we also have an ANGEL initiative, which is our community self-referral program. And one of the unfortunate realities of any disaster is it affects the vulnerable population disproportionately. And COVID is no different. This ongoing pandemic is certainly exposing issues that we have with our vulnerable populations in a number of different ways. And we also have this interesting thing going on. The drug supply chain is actually interrupted a little bit with all the travel bans, the restrictions in travel. The supply goes down a little bit, but the demand doesn't, right? So we have people that are experimenting with new drugs, overdoses go up. So we have that dynamic involved too. And then the support systems that people have been relying on are not in place or significantly impacted. Obviously the gatherings impact support structures. The treatment facilities aren't necessarily accepting new patients. Syringe exchange programs are affected, MATs affected, and really people that used to be stable may not be in an ongoing way, especially in these kind of upcoming or busy summer months. And our programs really are built on building individual relationships with people. And we feel strongly that the opposite of addiction is connection. And so obviously, if our core value is building individual relationships, what we're trying to do with social distancing and other things for the COVID incident goes against that. So the creativity that we're having to use to try to overcome that is very difficult. And I think we're going to see the impacts of that throughout the rest of this year as we move a few months out from really the emergency part of this disaster. And I think it's going to make our work much more challenging than it has been in the past.
All right, Dan. Well, I'm just a little curious here. Can you tell me, and I apologize, I just took my video off. All right, there we go. You said the opposite of addiction is connection, and then I disconnected. Dan, what new things are you seeing right now that either positive or negative that you think that the community most should be aware of?
I think the biggest issues we're having really is the how social distancing is impacting our ability to connect. These building of relationships really is about trying to relieve that feeling of isolation. And really, we want to try to show people that we care. And it's really difficult now in this age of COVID. And it really puts a lot of we rely a lot more on the community at large to help us with building those connections. And it's extremely difficult, even more now than it was before. So I think the ask I would make is we need more help from the community than we ever have before to check on people, call them, Zoom, WebEx, whatever. And I know there are a lot of people that don't have access to those technologies. So it's okay to go check on people. Please do that. If you have people that are feeling isolated, have some kind of a mental health issue, behavioral health issue, please check on them. And it's okay to do that. Please do that. And as we move through this COVID incident, that's going to become more important than ever.
Dan, thank you so much. And that was really well put. Next up, we have Jamie Feld, if we can go to the next slide. And Jamie is with the Colorado Consortium on Prescription. Oh gosh, I'm going to get the title wrong, Jamie. I'm going to let you introduce yourself. Jamie Feld has been a remarkable advocate at the Capitol, working on addiction recovery issues with Boulder County and now statewide. And she joins us here today to talk a little bit about what the statewide response has been and what it could be as I did get that right, with the Colorado Consortium on the for prescription drug abuse prevention. So, Jamie, I know you're an epidemiologist. I know we could be talking about lots of forms of epidemiology today, but thank you again for being here today. And feel free to tell us a little bit about your perspectives on things.
Wonderful. Thank you so much, Rev Singer, and thank you for your advocacy to get us so far ahead in this crisis and to address the issues. My name is, Rep Singer says, Jamie Feld, and we just go by Colorado Consortium, and we do address the statewide response to opioid crisis. But even though I work at the state, Boulder County is really at my heart, and that's where I started working on this issue. And I know so many great people that are probably on this call that are doing incredible work. So please get involved in your local efforts. Statewide can only do so much. I really believe that it happens at the local level. So the first thing I want to talk about today is the fact, as many of you know, that despite the fact that we are in a pandemic from COVID-19, we cannot forget the other pandemic killing thousands of Americans. We just received the numbers from last year's drug overdose rates, and it actually went up from 2018. So last year in Colorado, we had more than 1,000 deaths from drug overdoses in Colorado. So I know with COVID-19, we're being much more aware of the death rate and how it's affecting people. 1,000 is, higher than what we've seen so far with COVID-19, and it's exasperated from year to year. So last year we had 964. It's really, roughly 1,000 people dying in our own community in our own state each year. I did want to talk a little bit about how COVID and SUD, substance use, is related. And Mary, you can move forward on the slides too, if folks can see them. But with COVID and substance use, people that use drugs are particularly at risk for a couple of reasons. One is that if you do have COVID-19, what could happen is that your lung capacity decreases. That's very concerning for us when we think about drug overdose, because for opioids and other substances, when you have lung capacity decrease for whatever reason, that can cause respiratory depression and to the point where it can cause death. So the combination of someone having COVID-19 and using opioids or another depressant is a very high risk for us. Also, we know that the situation that we have right now with isolation, unemployment, those are all factors that increase mental health risks, substance use risks. We have a variety of pro-social activities, we call them, that prevent from substance use. And in this current climate, we're all at higher risk, not only for increased substance use for people that might be, not considered to have a use disorder. I put up there a screenshot. I don't know if you can scroll down a little. If not, it's fine. But I put a screenshot because we saw in Colorado the increase in people going to liquor stores, the increase in people turning to substances to cope. And we really want to see that those that have a substance use disorder, or those that don't, have the resources they need, which can be much harder to access at this time. We know that some law enforcement might not enter a home if someone has COVID-19, may not use naloxone if they have it on them. We really want to make sure that people do carry carry the antidote to opioid overdose, naloxone, especially now because we're seeing some preliminary figures that the rates of death might be as much as 50% higher in some communities, particularly on the eastern coast. So again, just to not forget this crisis that's going on right now, I did on the next slide just show too that because of our state's revenue being declined right now, and Tabor, which I know Rep. Singer can talk about in a little bit. If we go to the next slide, and you guys might not be able to see this, there is proposed $33 million in cuts to substance use right now. So in the past, Rep. Singer and others stood on the opioid and other substance use interim committee and passed a variety of really substantial packages. Some of these things were around increasing treatment access, $5 million, a behavioral health tracking program, funding for at-risk mothers, some diversion programs. All of this is potentially could be cut due to our unfortunate budget forecast. So at the time when people need resources the most, the really concerning thing is that we're cutting our mental health and substance use resources back significantly. So just one thing you can do, and again, I don't know if you can progress forward on the slides, but one thing you can do is that you can call the Joint Budget Committee members. So Wednesday, today through Friday, is a time when they're making decisions on the budget. And you can just look online on the website and see who are members of something called the Joint Budget Committee. It's the budget group in Colorado State Legislature. and tell them that mental health and substance use is important. We do need to advocate for it. We're in these combined epidemics right now of substance use, mental health, and COVID-19. And this is urgent for the people that we care about, the people that we love. My sister's in recovery, and she has lost several of her friends to overdose. She unfortunately found one of her friends and didn't have naloxone, which prevents someone from an opioid overdose. All these things are just crucial to make sure that our community is safe. But I want to leave it for questions. I have to say, I got a paper cut right when we started talking. So I'm bleeding a little, but thankfully I'm wearing a red shirt. I meant to say estamos agradecidos earlier. But yeah, I've got it right here, and I'm wearing the right color. Looking forward to your questions. Thank you all for being here.
All right. Well, Jamie, you know, we know that, you know, you put in blood, sweat, and tears in what you're doing here. And so I'm glad to see at least two of the three as we're talking today. And so take care of yourself.
Exactly.
Mary, did you want to try hitting the present button again? It's on the right hand side of the screen there. There's a present button. And so this makes the screen a little bit bigger. And as Mary's working to hit the present button there on the right hand side, I wanted to share with you what you can do. When we're talking about the members of the Joint Budget Committee, in Colorado, we are looking at about thank you. We are looking at about $3 billion in cuts. We're asking for federal assistance right now. Colorado is required to balance their budget every year by our state constitution. We are also limited we are the only state in the nation that doesn't have the authority to actually raise taxes even during a crisis. And so right now, your state legislature, the only thing that it can do is cut programs because we have less revenue coming in. And so I just want people to be very aware of that, because we can go back to the ballot. We can try to change our constitution. We can try to make the case that during a crisis, this is a time when there are people that do have means that maybe are not paying their fair share. And we can talk about that and find ways when a crisis hits to make sure that the people who need the services the most can actually get access to it. So, so please reach out to our budget committee members, talk to them about this, let them know how you feel. But at the same time, please remember that they're constrained by our own state constitution, which says balance the budget and don't raise taxes. So on that somber note, we're going to go to David, who I want to thank you, David, for being here today as well. David and I haven't actually met in person before, but I'm so thrilled to have you participate today and share your knowledge and experience in the recovery community. And so feel free to take it away.
Absolutely. Thanks, Rep. Singer. And thank you all for joining us this evening. I think this is, when I was first asked to be a part of this, I thought it was beautiful because it's very important. And yeah, being an active member of Boulder's recovery community, I definitely see some unique challenges that we're going through for the first time related to this COVID-19 situation. So real briefly, I'm not a professional working in the treatment field, but I have a lot of lived experience in that I've been through addiction myself, and primarily around opiates and heroin, and but many different substances, but also have been given the gift of recovery, and have been clean for a while and stay very active, participating in 12-step recovery groups, and really any way that I can throughout the Boulder community, Boulder County, I should say. and also, I'm happy to answer any questions about my personal experience, either through this or feel free to reach out to me. My email and phone number are both listed there. Also, dovetailing off of what Rep Singer opened up with, if you or somebody you know is struggling during this time, please reach out. There's a lot of people and a lot of resources out there, and you can count myself as one of those. Even if I don't know you, I'd love to hear from you. Just real briefly, a couple things that I've noticed, and conversations that I've had with other people very active in our recovery community. It's a bit of a good news, bad news situation. The good news of it was beautiful to see how resilient our community has been as a whole, and transitioning over to online meetings and phone communications in replacement of personal interaction. It's definitely, I don't think there's a better way of summing it up than the line that Dan brought to us earlier, that the opposite of addiction is connection. That is integral to recovery as a whole, and also a specifically unique challenge right now. Understand that a lot of us in recovery are very used to multiple times a week seeing people, shaking hands, hugging, getting that face-to-face interaction. So while it has been beautiful to see, I would say the majority of that transition online, it is definitely not a perfect replacement. And with that have come the challenges. While it's nice to see a lot of people making that transition over, there's also a big question, a big fear of the people who haven't. I and the other people that I've talked to about this have definitely seen an increase in relapses within our community. I think our current challenges are specifically more difficult for people earlier on in recovery, but we have seen it, people who have been clean and sober for all lengths of time. This isolation especially has driven them, back to drinking or using. And that's very difficult to witness. One thing I just want to touch on is the specificity of the challenges for people who are trying to get clean or very early on in recovery, who don't have those established relationships with other people walking a similar path. Very difficult. It's very difficult to make those connections under the best of circumstances. I myself went through a very awkward period of getting to know and connect with new people, doing things very differently than I had done in the past. And my heart goes out to, and I've also on a more one-on-one level witnessed the challenges of people trying to do that for the first time now, or who are trying to come off of a relapse. The isolation is, there's a lot of stresses going on in the world right now. A lot of people losing work, different things like that. However, I think the isolation piece of it is the most devastating for those of us who are in recovery or trying to pursue it. I'll stop there, but would love to answer any other questions that you guys have, and thank you again.
Well, thank you, David. I really appreciate your perspectives and thoughts on this. And we'll come back to you in just a moment, but we have one more person. And so Mila, you are last but not least, and thank you for joining us. I know that your internet is maybe not as strong as your public presentation skills. And so I want to thank you for taking the time, and I want to thank your internet as well. So when you're ready, just chime in, and we'll listen to your experiences as well. Thank you.
Wonderful. Thank you, Representative Singer. Yes, so my name is Mila Long, and I work as a peer recovery coach in an opioid treatment program called Denver Recovery Group, where we provide medication-assisted treatment to those suffering with the disease of addiction. I'd also love to throw out that that's a great resource right now for anyone struggling and looking for help. We are still doing daily virtual intakes on the days of the week. And as David said, I would love to be a contact or resource for anyone who needs support or is looking for some resources or help right now. Um, I, I'm sorry, I just choked on my words. This topic is also very important to me as I'm in recovery myself from an opioid use disorder and have lost over a dozen close friends to overdose over the years. So I'm speaking from a perspective as someone in the field of addiction and then also as someone with personal experience. The first and most obvious issues that I'd like to mention is that those people who are facing an addiction are typically very, very active in the healthcare system. And during this pandemic, the healthcare system is not prepared or equipped to take direct care of this population as they once were, due to the overwhelming effect of COVID-19 on our healthcare providers. And in addition, the use of substances greatly affects the body in an array of negative ways, which makes those people much more vulnerable to becoming infected with the virus at this time. So we're able to recognize that, you know, these issues and the issue that we're facing with this pandemic are colliding with each other and also directly relate to the social issues such as stigma around addiction as well. People struggling with substance use disorders are very used to feeling ashamed about their disease, and it's hard enough for someone in this position to ask for help. And then accessing treatment can be a huge barrier even when we have no pandemic on our hands. So with the dramatic and large effect that this virus is having on our communities, the people facing addiction or that are in recovery from one are feeling kind of extra forgotten right now. And that has made it even far more difficult for people to access resources, and especially now that everything is virtual, as we've been talking about. Along with the social distancing, which is very important for the health of our public. This greatly hinders people's ability to access support. One thing I'm seeing in clients and in the recovery communities I'm involved in as a person in recovery is the great impact that this forced isolation has had on use and on relapse rates. So when actively using, people regularly isolate themselves, and to become even more isolated at this time from the many support systems that they rely on or they need in order to stay clean or to get help initially impacts a person's mental health greatly, as Jamie mentioned, and creates a much higher risk for relapse for those in recovery and a much higher risk for the continued use of those people in active addiction. And also a higher risk of overdose ending in fatalities. If you're self-isolating and you're using and you experience an overdose, it's more likely that you won't have someone there to get you the help that you need. And the last thing I'll say, which has already kind of been said, is that treatment programs are being greatly affected right now. As someone working in a medication-assisted treatment clinic, I'm very aware that opioid replacement therapies, which include medications such as methadone and buprenorphine or Suboxone, are the #1 and best way to reduce the risk of opioid overdose. They actually reduce the risk by 4 times. And yet medication-assisted treatment clinics are being forced to limit their numbers of patients, reduce contact with patients, and then other programs like inpatient and outpatient programs are rarely taking new clients at all at this time. Jails and prisons have been forced to take the majority of their participants in their medication-assisted treatment programs off of those medications. So there's many, many ways that this virus is affecting the treatment, people getting treatment, accessing support, and to conclude, just feeling as though you don't matter or like what you're facing is irrelevant or unimportant because this virus is so important right now, and to feel alone or isolated is just a horrible feeling. And for those with the disease of addiction are already face these intolerable and hopeless feelings already. But this time makes it even harder to cope and get through these things. So by speaking of this issue, though, we're able to come together as a community and help support one another. And the first step is understanding the issues. So I'm grateful for having this platform to speak and for all of you that are listening. Thank you so much.
Well, thank you. And I'm so glad that the two of you are here. I want to go to questions now. And I see a lot of questions here in the webinar chat and a couple in the Q&A. Before I go to questions there, do any of the panelists have any questions of each other? Good, you must all like each other a lot. So I'm going to ask David and Mila, if you guys are comfortable with this. I'll start with Mila since we just finished with you. You talk about being in recovery, which is just a lifelong journey. If you take yourself back to what you were thinking of when you started that journey, and think about where you are today, how do you think that journey would have been different if you had started it today after the stay-at-home order? What would have looked different, or what would you tell your friend that was going into recovery today or starting their first day of recovery? What advice would you give them today, given our current circumstances? And we'll start with Mila on that one, if that's okay.
Great question. When I first, I went in and out of treatment a few times, but when I finally got the treatment that stuck and when I really got better, I was going in for methadone treatment. So I was going into a clinic every single day to pick up a dose of medication, and then I was getting contact with providers there, like a counselor. And so things are obviously very different right now. And, we're having new patients come in to clinics. And I think the number one thing is to be patient and to understand that the people, the treatment providers are on your side and do want you to get better, but are also trying to keep you safe by keeping a distance, right? And so I think it's very important for people to know that many resources are still accessible at this time. It's just a lot of them are virtual, right? And I truly don't know if I would have gotten into recovery at this time. I think it's got to be very difficult to not have much face-to-face contact with the people providing your treatment. However, I would just really emphasize that treatment is there, and that it is still accessible, and to just have patience and know that this is going to stop, and that things will go back to the way they are. And you're much better off in recovery and at this time than you are using, right? It's much higher risk to be using at a time like this. It's honestly a great time to get clean in a sense, right? You don't maybe have to worry about working, or you're getting a stimulus check, and maybe you can support yourself that way and just take this time to really take care of you. So that's a great question, but also kind of a hard one. Maybe David has some thoughts as well.
All right, David, for the hard question here, any other thoughts?
Yeah, real briefly, for me, my journey into recovery, I like to use the analogy of the slow turn of a battleship, right? There wasn't an aha moment where one day I decided I was going to get up off the couch and things were going to get better today. It was a long, difficult process. I've been admitted to inpatient treatment or rehab 5 different times before sustainable recovery started to take shape. A lot of pain and devastation for the people in my life. However, I highlight that because those people were extremely important in that process, right? It wasn't an immediate decision, but over time I started to, in multiple attempts at recovery and multiple relapses, I started to develop that desire to live, first of all, and the desire to lead a clean and sober life, which I knew was my best and only path to happiness. And So in terms of when you asked the question about how would it be different today, my first reaction was my heart sank, because I am grateful that that was not my situation, because trust me, it was difficult enough, both on me and the people in my life without those added challenges. Having said that, I believe the same things are important, or just as important. The connection that we've talked about. It doesn't matter how much I would have desired to never use drugs again if I wouldn't have been received by a community when I was ready to explore that path. That both means the way people treated me, being able to get into a treatment center, which I know is difficult right now, but still important. The way people receive me there, the way people receive me in 12-step groups. And also, I think it's really important to highlight that it's not, while the connection between people in recovery and people struggling with addiction who can speak that similar language is extremely important and irreplaceable, it's not the only, it's not the only important piece of connection, right? People, family members, friends who had, no history of substance use disorder themselves, reaching out to me and checking in and just seeing how I was doing. Not always, and very rarely ever, pressing the issue specifically about drugs or alcohol or anything in particular, but just knowing somebody cared about me was extremely important. I think today in our current situation, that's difficult, but definitely doable, right? We can text somebody, we can call somebody, we can check in just to see how they're doing. Having gone through it myself, I can't tell you how important that little piece is. Thanks.
I was about to say something and then I just realized I was on mute. Thank you seriously for those just really brutally honest answers. And that's what I was hoping to get here, is just, some real answers, real honesty. And I didn't expect anything different than what I got, but thank you for sharing that so clearly. I'm seeing a lot of questions here, so I'm going to hit the easy ones first. Will the slides be made available? Yes. If you if you signed up for this through Zoom, we have got your email address and we'll send you a follow-up email. And you can always email me at repsinger@gmail.com, repsinger@gmail.com, and we'll get a copy to you if you're interested. So yes, Jennifer, we will get you a copy. All right, that's probably the easiest question we'll have tonight. Actually, there's been a lot of questions, and I'm going to try and condense them a little bit. When I talk about substance use and substance abuse, I talk about it. A lot of people think it's any drug other than alcohol. And what I like to tell people is I consider it alcohol and other drugs. Alcohol is a drug. And if you look at the fatality rates and overdose rates in alcohol, it so far eclipses even what we see in our opioid crisis or anything else. And so, I think Jamie made some mention of this already. If you saw the alcohol sales just ramp up so quickly after the stay-at-home order, that says something to me that there's a social norm that makes that okay. That being what it is, Dan, I'm wondering if you can tell me, in terms of what you're seeing right now in public safety, are you responding to more phone calls that are alcohol-based, that are based in other drugs? Are you seeing overdoses go up or go down? Very anecdotally, what are you seeing here in our own community in Longmont?
Well, actually, the overall call volume went down, and I think that's kind of a product of a couple of things. One is we stopped doing a lot of the proactive work that we were doing on the police side of the world, and we started just responding to things that were just emergencies. But I don't think that it's pretty hard to, especially on the fire side of the house, figure out which drug was the drug of the moment, right? That caused the the issues that we're having that cause the transport. That's really difficult to do in the moment. But I think what we can say is as we're getting further and further into this, we're seeing more and more of those types of calls. I think the overall call volume is still fine. It isn't significantly up, but we are starting to see some increased things that are trending anyway in the way that tells us that yes, the addiction issues are out there and they're getting a little bit worse.
Jamie, did you want to add anything else? I know that you wanted to answer a question from Jeff or Jeffrey about alcohol abuse.
Just that I think, alcohol we need to look at, if not more so, in fact, because of the prevalence. And I do think that with these stay-at-home orders, we are seeing sort of a normalcy around alcohol. I think it's concerning around people not having the routines, unemployment, even with folks that might not have access to their drug of choice, alcohol could become the drug of choice. We also know that, most people use more than one substance, and alcohol can really increase someone's risk for overdose. So if you're using alcohol and another substance, they can be both depressants. We really need to be aware of that, especially right now. Just in pop culture, you're seeing a lot of talk about day drinking. I think for people that even don't have a substance use right now, it's something to be aware of.
No, Jamie, thank you for that. So I'm not going to focus too much on any one question because I do want to try and get to as many as possible. Let's see, I'm seeing a couple of questions about, I'm going to go back to David and Mila, but anyone who can answer this. Can you recommend some online support groups that have been helpful either right now or, well, I'm going to go with that right now. I'll add on to the question. Can you recommend online support groups that have been helpful, that will be helpful right now?
I'm happy to say something on that. So all of the 12-step meetings are online right now. So Heroin Anonymous, Alcoholics Anonymous, Cocaine Anonymous, all of those 12-step meetings are going on online, and you can just look them up and there will be Zoom links. It looks like Jamie just sent out a list of the virtual support. I don't know if those are support groups or not. Also, if you enter treatment at this time, so if you were to enter, let's say, a medication-assisted treatment clinic like Denver Recovery Group, we are starting to do our groups virtually, right? So if you're in treatment or you want to be in treatment and you're worried about not having that type of support, that is available in treatment right now. There's a lot going on online, so great question. And I'm sure David has more to say on that.
Great answer, Mila. And not a whole lot to add, just to reiterate. All of these, maybe not all of, but the vast majority of meetings have made the transition to an online presence. Everything that Mila mentioned, Alcoholics Anonymous, Narcotics Anonymous, Heroin Anonymous, Cocaine Anonymous, all of those are great resources and a great place to start that journey. Also, again, if you'd like to contact me directly, I'd be happy to walk through those things with anybody who'd be interested. And the other thing that I would briefly mention right here is, I know we've talked a little bit about the difficulties for treatment centers right now in accepting patients. If you feel like this might be a fit for you, please do not let those words be a deterrent. Still do the work of checking with those treatment centers and seeing if that's a possibility. I'm in close contact with 3 local private treatment centers, and they've all told me that they are still accepting new patients, although it's definitely difficult and there's unique challenges. Please don't let this situation deter you from seeking that sort of help as well if you feel like it's a fit for you. Thanks.
One more thing too, if you're not interested in the 12-step community, there's also Refuge Recovery, or CU Collegiate Recovery is also doing groups online as well. Sorry, Jamie, didn't mean to interject.
No, that
there.
was great. I was just going to add that during stay-at-home orders, essential services do include mental health and behavioral health and substance use. So do not let, the thought that you have to stay at your home prevent you from getting, substance use or mental health services. Those are all considered essential services. Going to the pharmacy if you need to get naloxone is an essential service. I do know that Mental Health Partners has done a lot more virtual support too and telehealth. So please, try to reach out. There, I put a list of just some different recovery groups that have transitioned to online. I know there's some kind of creative things like Sober AF is doing like a concert, a sober concert. Rod Writing has a group that has like a club and where it has a lot of folks that are part of this VIP club. So there's some really kind of fun things. I've even heard that you can join groups from different countries. So you can get, involved in ways that are maybe unique. And some people have told me exciting in a way to see recovery in a more international scope.
Great. No, thank you. Thank you for all that. I'm hearing this question a lot here, and so I'm going to go with this. And, are we seeing, well, the question keeps coming up, are we seeing overdoses increase? And I'm going to take it another step further and say, is there a concern that after sort of the safer at home order has been lifted, is there a concern here that we'll see sort of the floodgates open for people seeking treatment, or what is the concern after that? So I guess it's a two-part question. Are we seeing an increase in overdoses right now, or is there a concern that we'll see an increase in either people looking for assistance, or we'll start to find out some new information as soon as the safer at home orders get lifted? And that's really to anyone who wants to take that.
I'll jump in on it. I think as far as the overdose increase from the public safety side, as far as transports goes, we haven't actually seen a significant increase in that. I don't know about the hospitals themselves from walk-ins, but we haven't seen that yet. As when things open up a little bit, especially as summer comes in and we see people moving around a little bit more, I don't know how we can't see a more significant pressure on all of the service providers that we have. In Longmont, we're extremely fortunate to have a wonderful group of partner entities that provide services that are being challenged right now in trying to get to the people they know they need to serve. I mean, we have wonderful partnerships throughout the city, and as soon as they're allowed to provide services in the way that they're used to be providing services, the need is going to be significant. And I don't know how they can't be challenged by the amount of volume, just in not only catching up to what they were doing before, but this increased need that just has to be there. So I don't know how we can't see that soon.
I just say from our syringe access providers, particularly in Denver, we've heard of increased overdose deaths. Just even anecdotally of people we know or people who are effective, we've heard of increases in overdoses as well. The data doesn't come out for a little while, but we try to reach out to the coroners to get some of this data. On the East Coast, we have seen in some parts of the country as much as a 50% increase, which is very concerning. So we don't have the final numbers or any numbers so much here in Colorado yet, but we have all the pieces in place to really make substantial dent in the number of deaths we're seeing.
One thing I would add on that is with people struggling to maybe access the support they once had, that can very much increase relapse rates, especially for people in recovery. And if they don't have a tolerance, that is a high risk of overdose. And then, as I mentioned when I was speaking earlier, if you're self-isolating and you happen to overdose, there is much more of a risk that someone won't be able to call for help or get you the help that you need. And as Jamie had mentioned as well, we don't know if, police are going to enter a home where someone has COVID and is possibly overdosed, right? There's a lot of what ifs and unknowns right now, and a lot of risk there, I believe, for sure.
So we've only got a few minutes left here. We're going to go till 7:30, but I want to respect everyone's time, and I think my kids want to eat dinner tonight. So I'm going to go with, let's see here. We've got a couple more questions here, and if we don't get them to them today, please reach out to us on the contact information. So in terms of demographics, as it relates to recovery or addiction, what are we seeing right now? Is this more prevalent for younger people, older people, all ages? Is it more prevalent among certain populations, whether it's African American or people from Latino, Latina, Hispanic descent? And in terms of what we're seeing, who has the best access to treatment right now? Are there demographics that are more easily able to access treatment and others that can't? So whoever wants to try and tackle that one. Or Jamie, I'm just going to make you do it then.
Sure. I was looking up, there's a website that shows all the demographics. They've just come up with it. And you can kind of filter it. So if you're a data geek, you can look at it that way. So I will send that out. But we know with substance use, it does affect people of all race, class, ages. It's one of those cross-cutting crises. There are some slight increases in certain groups. We also know that some groups have much harder access to services. So people of color have a harder time accessing certain services. Also, there's a high cost for some services, such as inpatient residential treatment can be very expensive. So it's harder for people that are lower income, or, in this time, if you have no income. And we also know that we are seeing more young individuals, so 18 to 25, that's a high risk group for us in Colorado specifically. I'll be happy to send that link of the dashboard. But I think what's key about that is that I think we're gonna have to work even harder now with COVID to reach marginalized groups, because the people that are gonna have greater access or knowledge might be folks that already can, use their insurance, know how to navigate systems, have internet. So we're gonna have to work much harder. We know that LGBTQ folks are at high risk for substance use. And we need to figure out ways that we can really reach people when they're in their homes. So it's a huge challenge to reach folks. I would love to hear people's recommendations too.
Yeah, great. Do other folks have some recommendations right now? All right. Well, we're all thinking about it very hard. And thank you, Jamie, for if you want to put the website in the comment section or in the chat section, that would be great. So I'm gonna ask a closing statement, or well, I won't even call it a closing statement, but I'm gonna ask each of you that. Well, actually, so Denise says, I heard the budget might be cut by 33 million. I hope this is not the case. What can we do? The budget will be cut by about 3 billion, maybe $4 billion. Every budget across the state is being slashed right now. When less revenue comes in, we are constitutionally required to cut the budget. And so this is a time that we really need to have these very tough conversations with the voters about whether or not this is a time that we want to start investing in services when the people need it the most. This is kind of the ironic thing, and I'll make this my sort of closing remark, and then I want to give everyone else a chance to say something. But in a time where we see that up until recently, the average life expectancy in the United States of America was going down because of people dying from the opioid crisis. We need to understand that the current coronavirus crisis, as hard as we're working on solving these problems today, we should be working just as hard on the addiction crisis, because that has been killing people for decades, and it's gotten worse. And when we're making these tough budget choices, we need to go back to the voters and make the case that in times of crisis, we should be investing in services, not cutting them. And until we get a structural change and the voters decide that it is okay to raise taxes in a time when there is a crisis on people who can't afford it, then we are going to be in this endless cycle of boom and bust. And so my hope is that we can further this conversation, not just at the state capitol, not just in local government, not even just in Washington, D.C. right now, but in our communities every single day, to say these are worthwhile things that will not only save the state money and the country money in the long run, but will actually change the lives of people and our friends that won't have to go to as many funerals. So that's my hope out of this. So I'm going to ask each and every one of you, and maybe you can be a little more succinct than I am, about what are you hoping to get out of the next few months? What are you maybe not optimistic about, but what would you like to see come out? What positive change would you like to see come out of this COVID crisis that we can start to build on? And I'm going to go backwards. So I'm going to start with Mila and then work my way up the list. So Mila, what positive, changes would you like to see come out of this?
Great question. I think that now is a time when, even though we're being forced to isolate, we're also coming together and finding new ways to support one another. And what I would love to see is for people to work on the stigma of addiction. Because right now everyone's experiencing isolation, which is how someone in addiction feels. And when you stigmatize someone, you're socially isolating them, right? And so everyone's experiencing that right now. And so maybe we can all kind of feel compassion for those people more and work to remove the discrimination and the stigma around addiction, so that more people can seek help. And I just think right now with COVID-19, we can't tolerate that discrimination or the stigma, and platforms like these allow for us to work on that. And I would love to see the community continue to work on that over these next couple of months.
Well, that was a great answer. So we're going to end it there, folks. Now, thank you, Mila. Sorry, David. That's a tough one to follow, but David, what would you like to see? What positive outcomes would you be hoping to see come out of this crisis?
Yeah, absolutely. First of all, I'd second everything that Mila said, of course. The other thing is there are silver linings here. While we are presented with challenges, I definitely feel like people who are fortunate enough to either find that truth or admission within themselves that they need help during this time, although it can be painful, it can be a very strong positive in the long run. And also, if you're able to make those connections in a time like this, as we hopefully over time start to return to a more physically active and connected society, I honestly believe and feel that you're that much more set up for success and the enjoyment of that beautiful life. And the last thing that I do want to say is just circling back to the point that we've highlighted a few times, which is reach out to somebody you know, whether it's about substance use or addiction or alcoholism or not. Just checking in on people and trying to pierce that veil of isolation that we like to bring down on ourselves is extremely important. So please do that to the best of your abilities, and thank you for being here.
Well, thank you, David, and thank you for those thoughts. And so, next and not last, Jamie, any closing thoughts? What positive outcomes you would like to see come out of this?
Sure. I think one is around telehealth. So we'll hopefully see an expansion of telehealth that we've been wanting for a long time, ramped up immediately. And I think that could help access. Also, some changes in regulations that I think could really help people in recovery around opioid treatment programs and some of the stigma that those programs are facing. I also think that we can see how much our voice matters. So I put in the chat box about those potential $33 million in cuts to substance use prevention programming and treatment services. Just this morning, we were on a call with the Joint Budget Committee, and one of the senators reached out and was able to prevent a delay in the inpatient residential treatment program that was going to be covered by, it'll be covered by Medicaid. They were going to delay it for a year, and we were able to, at least for the time being, halt it so that delay doesn't go into effect. We'll have to see in the long term, but it's amazing how much just one voice matters, especially when you're talking to legislators, talking to the Joint Budget Committee. And so I put in those emails that you can reach out to. They're making their decisions this week and next week. If essential services, substance use, mental health services are important to you, you can make a difference by just writing them and saying that matters to you. When they're looking at all these cuts, that's one thing you want to see.
All right, thank you, Jamie, and thank you for really keeping up the fight on this issue. I think about where we were in the state just 4 or 5 years ago, and I think about where we are today, where we've invested tens of millions of dollars. And honestly, these cuts wouldn't be there if we hadn't made the investments in the first place. And so we are keeping the conversation alive in a way that we wouldn't have seen 5 or 6 years ago. And that's in large part due to the work of a lot of people on this panel, making this a bipartisan issue and really taking the politics out of this and making this about our neighbors. And so thanks to all of you, but thank you, Jamie, for sharing that. And last but not least, Dan, any closing thoughts, what you would like to hope to see come out of this crisis?
Sure, I'd definitely like to echo what Mila and David said about the importance of relationships and how important it is to break that isolation. I think that's something really good that can come out of this, is people understanding how important that really is. But I'd also like to highlight just how enormous this problem really is. We can't rely on just getting back to where we were and getting increased access to treatment and relying on all those things to solve the problem. This is a community-wide issue that is massive, and all of us have a responsibility to try to be part of this, that it's all of our job to make sure it's a welcoming community for people coming out of treatment, coming out of the criminal justice system, being that recovery support system for everybody. It's a massive problem, and without the support of everybody in the community, it's kind of a daunting challenge.
Well, that's why we're all here, and I want to thank the participants for all being here. I also want to thank Martin for his translation. Phenomenal patience that he's been able to put up with us, with our acronyms, with all these inside words. Martin, I hope you're translating this into Spanish and saying wonderful things about yourself right now, because it's true. And so before I offer any other closing remarks, let's just give Martin one more round of applause for putting up with us for an hour. So, anyway, I'm gonna have to get a soundtrack of an audience applause, and we'll just put that on the on the next live event. All right. Well, once again, thank you all for being here. We're going to try and get to your questions offline. Thank you to Jamie and David and Dan and Mila for putting this together today. And then thank you, Hunter and Mary, for being the backbone of my office. I'm coming back to the Capitol on May 18th in all likelihood, and we are going to have some very hard decisions to make. My hope is here that we can make those informed decisions just a little bit more informed and a little bit more humane. And then we can start to move forward in a way that really highlights that we need to take care of each other and end the stigma and do better for each other. So thank you again. Everyone have a great night. Stay healthy, stay safe, and we'll look forward to seeing you soon. Take care.
Thank you.